Hey, good morning. This is Steve Stites here at the University of Kansas Health System, Chief Medical Officer, broadcasting live with you from the Dahl Simons Family Studio. We have a special presentation this morning. We're with Deputy Secretary of Health and Human Services, Eric Hargan. We're delighted to have him. We've just been able to spend the last hour together. It was great. He's a Star Trek fan, as it turns out, so we have a lot in common. I'm also with Hawkeye, Dr. Dana Hawkinson, our Medical Director for Infection Control. We know how you all have a lot of questions this morning, but before we go to those, Secretary Hargan, I think you have an opening statement.
Yeah. Thank you, Dr. Stites, and thank you all actually for all the work you've been doing to keep local communities informed about the pandemic. I've been told you've gained an international following for your daily COVID-19 updates, so please keep spreading the word. This is incredibly important public health work. I also want to thank KU for hosting these important presentations and discussions and for partnering with us as we combat this pandemic. As some of you may know, thanks to Operation Warp Speed, our Star Trek reference. Our Star Trek reference. It's our historic project to create safe and effective vaccines and therapeutics by the end of this year. We currently have 4 vaccines in phase 3 clinical trials, the final stage of clinical trials. One of those trials has been taking place in part at the University of Kansas, so thank you for doing the vital work to make that possible. As many of you also know, the trial for this vaccine candidate made by AstraZeneca is currently on hold. We all hope it can resume as soon as possible, but the caution here goes to show that safety and efficacy are of paramount importance, and the American people can rest assured that we're not cutting any corners when it comes to the processes that we need in order for Americans to have confidence in a COVID-19 vaccine. Through Operation Warp Speed, we've also made remarkable progress on therapeutics. We now have 2 monoclonal antibody products supported by Operation Warp Speed that have submitted data to FDA for potential authorization. Substantial amounts of these products have already been produced and continue being produced as we speak, so they can be distributed as soon as possible if and when they get the go-ahead from FDA. National Institutes of Health also recently launched a new round of clinical trials on drugs called immune modulators. FDA officially approved the antiviral remdesivir yesterday, which has been administered already to hundreds of thousands of patients throughout this year, and Operation Warp Speed supported clinical trials continue for that drug in combination with others that may create an even more effective treatment regimen, a cocktail of therapeutics that will allow us to cure this disease. We also have several randomized controlled clinical trials underway to produce more data on convalescent plasma, a promising treatment to which Americans have enjoyed broader access than anywhere else on earth, thanks to the generosity of tens of thousands of recovered American COVID-19 patients. I also want to underscore that protecting the most vulnerable in society has always been at the heart of our response. That's why last week we announced an unprecedented partnership with CVS and Walgreens to deliver and administer safe and effective COVID-19 vaccines when they are approved to long-term care facilities across America, including nursing homes and assisted living facilities, where more than 2.5 million of our most vulnerable citizens live. These people will likely be one of the very first groups to be vaccinated, and I am proud of our collaborative work that's making this happen. Now, I would be remiss if I don't join Dr. Stites in providing a general public health update as well. While we're moving closer and closer to distributing a safe and effective vaccine, we are by no means out of the woods yet. Epidemiological trends in large parts of the country remain concerning, including in the Kansas City area. Rising case counts in much of the country are likely in part driven by people spending more time inside as the weather gets colder. You know, I'm from the Midwest. I know that's going to happen.
It is getting colder.
But it's just something that everyone needs to be aware of as we move forward. That means we have to keep taking steps to keep ourselves and those around us safe. That can be done by using what we're calling the 3 Ws, washing your hands, watching your distance, wearing a face covering when you can't watch your distance, and avoiding settings where you can't do these things. These are basic hygiene points that we have been emphasizing all along. We just need to keep going on these simple and we think effective actions. These actions can go a long way in protecting yourselves, your families, and your community. They're absolutely essential to bridging the gap to the delivery of vaccines and new therapeutics. Thankfully, we can see the light at the end of this tunnel, so let's continue to work hard to preserve the health and well-being of all Americans.
Thank you, Mr. Secretary. No, that's great. And, you know, Dana and I say every day, it's all about the pillars of infection control. They travel with you, Dana, wherever you go.
Absolutely.
Yeah.
They're simple. They become second nature. Distancing, masking, hand hygiene, not meeting in large gatherings.
And, of course, it's very appropriate in the Midwest. We know we all have cows. COVID weariness syndrome, Mr. Secretary. We wanted you to learn something new here at KU. Cows, COVID weariness syndrome, because we know that we all have that. And the best way to handle cows is to stay safe and know you're going to get to the other side because hope is on the way. Jill, let's hear some questions.
All right, I'm going to start with Mary from Wyandotte Daily, and then the other reporters on the line just jump in right after. Mary wants to know, what specifically is the HHS working on? Are there contingency plans if the COVID-19 case numbers continue to grow in the Midwest?
You know, Mr. Secretary, that's interesting because we've talked about just earlier, do we have to close everything down? Or if we can just work to stay safe and follow the principles of infection control, we can also stay open.
Yes.
I think we all want to do that.
Yeah.
Yes, yeah. I think that, you know, we are continuously working with the states and localities who have been working on the plans to make sure people keep safe, following those basic hygiene issues that we have outlined, that the public health community has embraced. You know, we do know that this is a viral contagion. Cases are going to continue to arise in different localities. They have, you know, from the very beginning when we saw the tremendous outbreaks in the New York metro area and Boston, Chicago, New Orleans, moving into the Sun Belt tier from California to Florida, where we saw cases arise over the summer. We know over the last couple of months there's been a strong movement of cases, unfortunately, into the Midwest. But I think that, you know, a tremendous amount of treatments and a tremendous wisdom that has arisen in the communities that have already dealt with these issues, being able to be transmitted and adopted in places that are suffering cases right now. I think we're doing far better now than we did at the very beginning of this, naturally, because it was a novel virus that we were dealing with at the very beginning. But I think we've achieved a lot, both in public health and research and development, and hopefully due to the efforts of our research and development teams here in the United States and the companies that we've been able to partner with, putting an end to this in short order, God willing, but also until then, as we were talking about earlier, being able to bridge that gap with these simple public health messages to be able to get to the communities and be able to put an end to these outbreaks as they arise. But I'll turn it over to the doctor to talk about some of these issues as well.
Absolutely, 100%. We have to continue to be vigilant to do these. We know that cases are going up. Hospitalizations follow cases. Mortality follows hospitalizations. So these are simple things we can continue to do moving forward, and hopefully in those communities that you're in, if it's a rural community, urban community, continue to do those basic principles.
So important. Jill, next question from a reporter. Let's hear what we've got.
Hi, this is Taylor Hennis from Channel 41. Mr. Secretary, we're the local NBC station. Last night, the president during the debate used the phrase "rounding the corner" for what's going on with COVID-19 right now as a nation. Is that true? And if it's true, what does that mean that we're rounding the corner? Is it a milestone Americans should look for as far as vaccinations? What does that mean if it is true?
Is it rounding the corner or rounding a corner?
Yeah, well, that I think is a relevant thing. What I think we are looking at here are so many improvements on the research and development side on that I think we are and have been rounding a corner for some time in terms of the production of a vaccine and being able to get the data necessary from the clinical trials that are ongoing, both with regard to the 4 vaccines that are in the last stage of clinical trials, as well as literally hundreds of therapeutic candidates that we're seeing very promising and encouraging signs on a number of fronts, being able to both look forward to a vaccine being able to be declared safe and effective by FDA, and then looking forward to a cocktail of therapeutics that may be available that will allow the medical community to be able to essentially mitigate or cure this disease. In addition, both the announcement of the full approval of remdesivir as an antiviral, a lot of the advances that have been made in in the use of dexamethasone and other steroids as part of a treatment regimen, and then the two companies that have come forward to look for authorization on monoclonal antibodies, which is another promising area of treatment, as well as convalescent plasma and a lot of other things where we've gotten a lot of great clinical trial data that I think is going to be able to enhance the response that the medical community has even before we get, God willing, a vaccine, safe and effective vaccine approved by FDA.
Jill, next question. What do we have? Is there another reporter on the line that has another question? Otherwise, I'll jump in because I've always got questions.
Can you guys hear me?
We can. Go ahead.
This is Tim Carpenter with the Kansas Reflector, and we have a lot of controversy in Kansas about wearing a mask, despite what the two doctors there say. So why hasn't HHS come forward with a recommendation on a national mask mandate?
Well, masking is always kind of one of those things that none of us want to wear a mask, but we know in a hospital how safe it is.
Yeah, I mean, we've got lots of. You have to look to see what the federal role is versus the state and local roles in the system that we have. The federal government has limited numbers of powers that we have. A lot of our powers really are dealing with things like interstate or international issues. They're not really dealing with those local issues about mask mandates. So we don't actually have the kind of powers that I think people might imagine we have in terms of requiring a mask across the entire country. It comes down to what advice we can give, what kinds of data we can share, what kinds of research we can do, and kind of helping to set standards and really taking the lessons learned in one area and being able to give them to another and making recommendations. And that we have done. So CDC, you heard me just say it, wear a mask. That's the 3 Ws. Those are the kind of things that we do advocate for. CDC has accumulated, I think, at this point, 19 different clinical trials that have shown the efficacy of wearing masks and have made that information available to people who are going to be setting these standards locally. But a lot of that comes down to states and localities choosing to sort of advocate or require these things in areas. And those have been being required nationally in states and localities. So that is being taken care of by the local public health authorities. And we are providing what backing and information and research that we can to enable them to make the decisions for their own communities.
You know what we know, Dana, is that wearing a mask clearly helps because in the hospital where we wear masks, COVID doesn't spread. Talk to a little bit about it.
Yeah, absolutely. To start, early on in the pandemic, we really didn't understand about SARS-CoV-2. There's still little data about SARS-CoV-2 specifically in masks, but there is getting more. We know that international studies in populations show a decrease in spread of the disease, a decrease in mortality. We get down to the United States now. We have more evidence. We know from very well done published studies that people in the hospital, healthcare workers, have a lower seroprevalence rate, meaning evidence of infection, than the general public because of those PPE measures, most notably the mask wearing within the hospital. And again, in the hospital, you have a high number of patients with COVID, so you would expect the exposure risks to be much greater than out in the community. And in our own hospital, we have certainly anecdotal data to back that up as far as spread from healthcare workers to our patients or patients to our healthcare workers as well.
I think that's the most remarkable part, Mr. Secretary, is that hospitals are the hottest of the hot spots, and we don't spread it inside.
Right.
And so I think that's the story of masking that we need to be told. 3 more questions. Okay, go. Next question, reporter. Somebody jump in.
It takes a minute.
Or I have to start singing. Nobody wants that.
Hi there. This is Jacob Kittelstad with Fox 4 News here in Kansas City. Hoping you can hear me okay.
Yep.
I just had a question. How are you planning on building trust among communities of colors and other groups that have experienced, historic health injustices in the rollout of this vaccine? And how are you going to be addressing, the general distrust and kind of a heated political atmosphere?
Boy, we're right here in Wyandotte County, which turns out to have one of the most diverse countries, or diverse counties in the United States, surprisingly.
Yeah, part of this has been, we've been building these messages in since really the very beginning, and CDC, which is our sort of premier public health agency in terms of sort of getting the message out into communities, has been working on a Vaccinate with Confidence program. It's getting into communities, racial and ethnic communities that have shown that there is some mistrust of all kinds of issues that really have to be addressed to make sure that we get this vaccine into every community. It would be, for us to put an end to this pandemic, we are going to have everyone participate in this process, and no one wants a community to have that mistrust. And then also for that mistrust to result in low levels of vaccination and the persistence of this disease in these communities. Part of it has been a real emphasis on enrolling people from minority communities into these vaccine trials. And that has been something that we've been concentrating on for a long time and have had real success at this so that people can get out there. I was just recently in Savannah, where this is also an issue where this has arisen early on, and was meeting with a woman of color who is very prominent in the local community, who was actually the first person in the world to go into a phase 3 clinical trial for one of these vaccines, who stepped forward with courage and generosity to volunteer to be the first person to receive the vaccine. And to sort of hear the stories of the reaction of that in the community, that's what's necessary, is for people to participate in these public health efforts and for us to be able to get the message out publicly. And that's always going to be a challenge, but it's something that we are absolutely willing and eager to do, is to engage with the questions, to engage with these communities, to make sure that we let them know that we are confident about the vaccine. As soon as it's available, I intend for it to be in my arm, and I'm absolutely going to get it done. That shows my confidence. I know the people who are doing it. I know the people who are conducting the trials, and when the minute that FDA gives us the all clear, I want it to be in my arm. So we have to get all communities in the United States to participate in this. So we're looking forward to it. We've been messaging out there, engaging the communities, and we're going to keep doing that as long as necessary for this to put an end to the scourge.
What was that turn of phrase you had earlier about arm counts? Or
we're going to get it in arms. We're going to get it. Yeah, we're going to get it in arms. We're going to get this in arms.
All right.
We started a little late. Can you go for a minute or two more?
Sure.
All right, 2 more questions. Let's go. Next media person.
This is Taylor 41. I've got another question if no one else does about the timeline of the vaccine. We mentioned kind of tiers of when people can expect it, whether it's going to go to first responders first or people on the front lines first, that kind of thing. Yep. I'm curious about when Joe, Kansas City, me, can reasonably expect to get that.
Sure.
Because I'm not on the front lines. I'm not in any at-risk categories. When should I reasonably expect to or hope to be able to get a vaccine?
Well, and we know that there are some vaccines that are approaching that EUA stage between Pfizer and Moderna, and fingers crossed.
Yes, exactly. So we have 2 vaccine candidates that have really been in arms since late July. That means that we're closing in on 3 months of data on that. FDA is going to go, I think, farther. We're going to start seeing into next month, towards the end of next month, I think that they've announced they're going to look at the data. I think that some of that's going to be the companies themselves choosing to come to the FDA and say we have confidence that we want to get the authorization from FDA to do that. So some of that is, that's going to be nature and science taking its course, and that's not something that, we can call into being by the government, no matter how many meetings we have, and no matter how many good wishes we have to make sure that we have a safe and effective vaccine. And that's going to require the data to be there for these. But we have a great deal of sort of encouragement from the data that has been produced so far that we're going to have good results from these. So that's one thing. The good thing about Warp Speed is that we're both working on the research and development side, and then we have teams also working at building out the manufacturing capacity, and we have teams working on the distribution system all at the same time. So instead of doing it traditionally, going from R&D, then to manufacturing, then to the delivery system. We're doing all of them at the same time because this is a national priority. So we're doing all of these at the same time in order to shorten the time from the approval to getting it in arms for everyone in the country. So now take that, look at the allocation and distribution. First, we had got a report from the National Academies that said, here's how we should do allocation. CDC released guidelines on how that should go. Healthcare workers, frontline workers, the elderly and other vulnerable populations, prioritization on through. The states, I think Friday, Kansas and other states put in their plans to CDC about how they're planning on implementing distribution at the state level. And we've also announced partnerships with CVS and Walgreens, as you heard, to be able to get this vaccine into nursing homes when we have it available. Now, the next question is, well, how many doses and when? Production is already happening of these vaccines. We don't have 330 million courses of vaccine. We're going to have rolling production, as you might expect. When the factories get going at full speed, then they're going to be coming available. As they come available, we'll be working through the allocation and the distribution according to the guidelines that we've gotten and the plans that the states have submitted to us. So that's how we're planning on this kind of radiating out to the states and localities. The plans are out there now, and the guidelines are publicly available to see when that's going to happen. So, and some it's going to depend on how many vaccines are approved. We're not planning on just saying just because one vaccine got across the line, we're going to sort of down tools and say no more. The other companies are going to continue moving forward on their own research, and hopefully we get more than one vaccine. We've got 7 candidates that we've narrowed it down to, but there are more companies in this space globally who are trying to produce this vaccine. So hopefully we're going to have more than one candidate, more than one set of production facilities. So I think that's going to just depend on when the vaccines are approved, how many are approved, in what order, and then getting the manufacturing going and getting it out and distributed. So that I can't give you a date certain on that. I can't even give you a date certain on when we're going to have a vaccine, other than to say that for me, as a person who is monitoring this very closely, and as the Deputy Secretary of HHS, I say it is very encouraging, and we have very hopeful signs that we're going to have a vaccine relatively soon, and then we've already got the vaccine manufacturing built out. I'll say I was just a couple weeks ago in Texas and saw a facility that was literally a concrete slab in mid-July that is now a factory. And that's because we were able to dedicate the resources, get the expertise in place, and have that stood up. It is amazing what this country can do when we put our mind to it. And for us to be able to move so rapidly from one to the other, we just have a tremendous amount of hope that we're going to be able to move this process through more quickly than it's ever been done before, that's for sure. But with all the attention to safety, with having very large vaccine trials, multiple vaccine trials, making sure that we've incorporated all the racial and ethnic communities in the trials to make sure we don't miss anything in this process, different age cohorts, making sure we don't miss anything in terms of being able to get as much safety and efficacy data as we can to the FDA to allow them to make a good informed decision about these things.
All right, we have one more question still. Is that right? Let's see. Nope, we're done. All right. Mr. Secretary, I want to thank you. That was great.
Yeah,
Hawkeye, any
great.
Closing thoughts?
No, absolutely. We know that the question was brought up and it was excellently answered about ethnic disparities and minority disparities. We know that that is important around the nation. Those disparities have been exaggerated by the pandemic. I think it's going to boil down to the local communities, the local health departments, partnering with local congregations and communities to really get that word out and encourage the vaccine when it is proven to be safe and efficacious, because we have to protect our most vulnerable populations. And there are quite a few. There are there are several vulnerable populations and demographics within the United States that we need to protect.
Yep. I would just finish by saying thank you. Thank you for being here. And then just to say, hope is a really important thing. And one of the things we've tried to do on our morning media update is project not only the honesty and the reality of what's going on, but hope. And I will just say that when we started this pandemic, our mortality rate in the hospital was around 15%. And today it's less than 6%.
Yep.
We've already found hope.
Yeah.
And the hope is best found when we work together and come together and do things like this. So, Mr. Secretary, thank you so much for being here. Thanks
Thank
for
you.
projecting some hope. Any
Thank you.
final thoughts?
Thank you for hosting. You know, and I say, even apart from the work that we're doing on Warp Speed and the scientific community is doing, the fact that the medical community has been able to get so many great lessons from the early days of this and the real problems that we had coping with this, not just us, but in Europe and in China and Asia as well, that we've been able, just through intelligent things that have been recognized by the medical community and passed on, lessons learned, that we've been able to achieve so much against this disease, even without having the vaccines yet. I think gives us it's a tremendous achievement, to be honest, from where we were to where we are, and I think we get better every day.
That's what we can do when we stand together.
Yep.
And of course, one other Star Trek phrase, which is especially appropriate to this, let's live long and prosper.